Welcome to LPN LaunchPad's review of drug actions and interactions. This presentation provides a comprehensive overview of drug actions and interactions, delivering the essential knowledge required for future nurses to ensure safe and effective pharmacological practice. Understanding pharmacology is fundamental to nursing practice. It involves studying drugs and how they affect the living body, not just memorizing names, but truly grasping how these substances work to restore, maintain, or influence body functions. Nurses play a critical role in administering medications safely and caring for patients, so understanding key principles like pharmacokinetics, pharmacodynamics, and pharmacotherapeutics is essential. Drug action begins when a drug binds to specific receptor sites on cells. Think of it like a key fitting into a lock. This binding can then trigger, inhibit, or partially influence cell functions, depending on whether the drug acts as an agonist, antagonist, or partial agonist. Specificity and how selectively a drug binds to its intended target are crucial. For instance, insulin mainly targets insulin receptors to help with glucose uptake, which helps minimize effects elsewhere in the body. When preparing for exams, focus on understanding the mechanism of action for common drugs. It is essential to distinguish between agonists, which activate receptors, and antagonists, which block them. It is also necessary to grasp the importance of drug specificity in minimizing potential side effects. The therapeutic effect is simply the beneficial outcome of a drug. For example, antihypertensives are explicitly given to lower blood pressure. The therapeutic effect is their desired action. Nursing considerations naturally involve monitoring vital signs, assessing for the expected improvement, and carefully documenting the patient's response. Sometimes, a drug causes an idiosyncratic response, which is an unpredictable or unusual reaction specific to that individual. It is often linked to genetic factors and is unrelated to the dose. A classic example is hyperactivity with a sedative, requiring nurses to observe closely and document everything thoroughly. A paradoxical response is the opposite of what is expected from a drug effect. For instance, some patients become agitated when given a sedative. Healthcare providers must be ready to recognize, monitor closely, and quickly address these unexpected reactions. Hypersensitivity refers to an exaggerated immune response to a drug. This can lead to allergic reactions, ranging from mild skin rashes to severe, life-threatening anaphylaxis, sometimes seen with penicillin. It is imperative for nurses to consistently assess patients for allergies and remain vigilant for any signs of an allergic reaction. Side effects are undesirable effects that predictably occur alongside the therapeutic effect. Nausea with antibiotics is a typical example. Though it is often mild, it can be annoying. Nursing interventions typically focus on managing these symptoms, educating patients about what to expect, and letting them know that some side effects might lessen if the drug is taken with food. Adverse effects or adverse reactions are more severe than side effects. They are unintended, undesired, and unpredictable responses that might even require stopping the drug entirely. Examples include severe liver damage or hepatotoxicity from an acetaminophen overdose, or kidney damage known as nephrotoxicity. Critical nursing responsibilities include prompt detection, reporting the findings, and intervening quickly for adverse effects. For examination purposes, memorize common drug side effects and adverse reactions and differentiate between them. Practice prioritizing nursing actions based on how severe a reaction is, remembering that adverse effects usually demand more urgent attention. Drug interactions happen when one drug changes the effect of another. An antagonistic effect occurs when one drug reduces or blocks another's effect. Naloxone, for example, reverses the effects of opioids. Awareness of potential interactions and monitoring the drug's desired effect are vital for patient safety. A synergistic effect is when two drugs working together produce a much more substantial impact than either could alone. Consider alcohol combined with sedatives. Both depress the central nervous system, leading to significantly enhanced sedation. Synergistic effects require nurses to monitor very closely for these amplified effects, which can be dangerous. Food interactions can also significantly alter how drugs are absorbed, metabolized, or excreted. Grapefruit juice, for example, is well known for inhibiting the metabolism of certain medications, potentially boosting their levels and effects. Therefore, educating patients about specific food-drug interactions is a key nursing role. When studying for exams, prioritize learning the common drug and food-drug interactions. Focus on interactions that change a drug's effectiveness or increase the risk of toxicity. Try to understand the mechanisms involved, like enzyme inhibition, changes in absorption, or altered pH levels. Let us test that knowledge. Here's the first practice question. A patient is prescribed a drug known to have a narrow therapeutic index. What does this mean for nursing care? A. The drug is very effective. B. The drug has minimal side effects. C. The drug requires close monitoring for toxicity. D. The drug can be administered safely without regard to blood levels. The correct answer is C. The drug requires close monitoring for toxicity. A narrow therapeutic index means the drug's effective dose is very close to its toxic dose, so careful monitoring is essential to prevent harmful outcomes. Here's another question. If a patient reports taking an herbal supplement and a prescribed anticoagulant, what should be the nurse's primary concern? A. The supplement will increase the anticoagulant's effect. B. The supplement will have no effect. C. The supplement may decrease the anticoagulant's effectiveness. D. Herbal supplements always cause adverse reactions. The correct answer is C. The supplement may decrease the anticoagulant's effectiveness. Herbal supplements have the potential to interact with anticoagulants, potentially lessening their effectiveness, and thereby increasing the risk of clot formation. Note: for this question, you have to differentiate between all the possibilities that could happen, A, B, and C, and then determine the worst and most common outcome if it is true. The worst outcomes for a patient on anticoagulants are either high anticoagulation, which leads to increased bleeding, or decreased anticoagulation, which leads to more blood clots. Now consider the patient's reason for being on anticoagulation, which is most likely blood clots or implants that increase the risk of blood clots. The history of blood clots in the patient's history makes having more blood clots a more likely risk for the patient, making answer C the nurse's primary concern. And one final question. If a patient develops hives and itching after receiving a new medication, what type of reaction does this indicate? A. Toxic effect. B. Side effect. C. Allergic reaction. Or D. Idiosyncratic reaction. The correct answer is C. Allergic reaction, hives, and itching, which are common signs indicating an allergic or hypersensitivity response triggered by the immune system. To summarize, drugs work by binding to cell receptors, causing various actions, some therapeutic and some unintended. Interactions between drugs, foods, or other substances can significantly change a drug's effects, highlighting nurses' vital role in administering medications safely and providing thorough patient education. For success on your exam, always prioritize patient safety when administering medications. Build a strong understanding of pharmacokinetics, how the body handles drugs, pharmacodynamics, and how drugs affect the body. Be ready to identify and manage adverse drug reactions effectively. Thank you for listening to this presentation on drug actions and interactions. I encourage you to ask questions in the comments section. I enjoy helping students learn, and answering questions is the best way to do so. Questions are essential for instructors to know what their students understand and what needs to be covered more thoroughly. Please ask your questions. Providing the answers will help us both. Please like, subscribe, and comment if you find these presentations or the practice questions helpful. Each one helps me to grow this channel and to continue this project. Hey there, this is Brian, the creator of LPN LaunchPad. I aim to give every student a fair review for the NCLEX for free using YouTube videos that can be watched or listened to without losing value. It may be free, but it is still valuable. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe buttons and continuing to watch my videos. Also, check out the free ChatGPT NCLEX review quizzes I have made to accompany these videos. A link is in the description or search for LPN LaunchPad in the Explore GPT box. This review has been an LPN LaunchPad production. We care for our future nurses by freely sharing knowledge.